Hi, Dr. Bregman. How are you doing today?
Good. Hi, Linda.
We have a question from a father of a student that is going back to college. And he says, Dr. Bregman, my son is going back to college, which is great since he was pretty much quarantined in the house all summer and extremely bored. The problem is he's suffering from anxiety. Now, this is a condition he's had for years. It's usually under wraps until he gets into a stressful situation. The pandemic is a stressful situation. What should he do if he has an episode while in college? Where should he get help? And that's from Brian, who comes from Framingham, Massachusetts.
Okay, well, Linda, I see a lot of this. My practice is across the street from the University of Miami. What I would say is, first, the student needs to go to their mental health services, at the university, and most of them have pretty good health services. And there, they either have a therapist or psychiatrist there, or they could, like with me, they refer neurotic patients from the university across the street, and and then I see the kids in my practice. So parents all over the country could find psychiatrists in the area if they want. And really, when I see the kids, I say to them, especially if kids have pre-existing illnesses, and this child has a pre-existing illness. So with all the stress going on and anxiety, 60% they say of the kids are suffering from real anxiety disorders. And if you had one before it's pre-existing, then you really have a problem. So a lot of times I see the kid will tell me, look, doc, I have panic attacks, I'm worried all the time, I'm scared out of my mind, I don't want to tell anybody, you're not supposed to, the kids will make fun of me. So I say, okay. So look, I want to call your parents. I said, I always get parents involved. Is that okay with you? And most of the time, the kids say, yeah, doc, but when the kids say no, I know there's a real problem there. So then I get the parents on the phone right away and get mom and dad involved, and they know me. And then I set the kid up with some therapy or med management if they need it. And the parents now have written consent to talk to me, and we're all on the same team. And then a lot of the parents feel much better. They don't have to rely on the kids' friends to tell them that their kid's okay.
So I'm sure that this gives peace of mind, not only to the student, because there's some hand-holding, great advice, propping them up during this stressful time, but it's wonderful for the parent, especially when they're from out of town.
Absolutely. The parents usually are so thankful. A lot of times, it was only in recent times that the kids didn't go to the doctor without the parents. I mean, you always took your kid to the doctor. So now the kids in the pandemic is having panic attacks. Nobody knows what to do. The kid doesn't even know if he wants to stay in school. And now they meet a doctor who's going to help them. So it really makes everybody feel much calmer, and it really works.
Well, great advice as always, and good luck to all the college kids in going back to college. Study hard and wear your mask, right?
Right, and if you need help, reach out, get some help.
Absolutely. Well, thank you. Bye-bye.
Take care. Bye-bye.
Don't suffer alone. At BregmanMD, we can help with our years of online therapy experience. Just give us a call or contact us online.